Kia ora koutou, ko Martin von Randow tōku ingoa. As Barry has just said, I have been data manager / analyst since the end of 2004. We had our first colloquium, I think it was 2007, I think we were doing, because this is 18. And I've presented on survey stuff at least 3 or 4 times, as well as things around our short courses and a few other bits and pieces and projects. I want to go first into detail in terms of, I've more recently described myself as a data manager because it makes it a bit easier to understand a whole lot of the other things that I'm responsible for. I've always been involved in the census and more recently IDI data analysis. I've been responsible for our campus website, which this is the easiest link these days to reach us. Unfortunately, if you Google us, it comes up generally with campus.auckland.ac.nz, which used to work quite well, but at the moment doesn't. We're trying to work out why with the university. And it's really annoying to have a Google top link that doesn't work, but they have provided us auckland.ac.nz/campus research. As was alluded to in the previous presentation, we do now have a campus YouTube channel, partly because the University of Auckland website was upgraded in terms of the back end, and they were no longer hosting video files. So a lot of our previous links of seminars and things no longer worked. And we got that set up, and that now has, I think, 56 videos, and the recordings from today will end up there as soon as I get a chance to go through this massive recording that we can take on. As Eileen mentioned, that includes last week's campus seminar by Li Chang on missingness. And as she also alluded to, the Virtual Health Information Network, which Barry has also mentioned, especially in relation to our courses in the ODI. A lot of you possibly already on the mailing list for that, but if you are not on the mailing list, we do a monthly webinar for that group now, and that is mainly a lot of people talking about analysis they've done in IDI data. If you want to be on the mailing list and are not, you can email me, chain@otago.nz, which comes to an Auckland mailbox as well. And there's a Facebook group for that, although we are now sort of moving people more for support in that area to the ID Commons, because it is really a platform for discussing that sort of thing now, and they're allowing people in who are not yet doing that sort of work. And the short courses, we've mentioned that several times today. Again, if you're not on the list for that, NZSSN courses at auckland.ac.nz is the one for that. The main thing I want to talk about today is the administration of surveys, as Barry said. Taking you back a really long way, our founding director, Peter Davis, was involved in a lot of health-related surveys before campus, starting with his PhD work in the 70s, which was part of the survey of adult oral health, in the 80s and 90s to Waikato-based medical care surveys. 1991 saw the phone survey on partner relations, the New Zealand Quality of Health Care Survey in 1998, the Adverse Events Study, and culminating in the National Primary Medical Care Survey in 2001, which was still going strong when I had my first ties with the people that became campus in 2004, working on an arm of that study, looking at just data dumps from hospital emergency departments, and we were sort of getting those into line and performing similar exploratory analysis. The stack of 9 reports that came from that survey, we got so many copies of, they now hold up my laptop stand in the office. So that's convenient. Until recently, they were all hosted at the the Ministry of Health website, but I found that they're quite hard to find now. It is 20 years ago, so links have been lost a bit. But in 2005, after all that, Peter was sort of realizing limitations around data analysis, around data collection, and especially realizing the underuse of collected data, survey data, so really moved to a focus on secondary data analysis. We got access to census data and were very much pioneering in the data lab at 70 Simon Street, as it was at the time in Auckland, in the Uni Services building, with 2 computers on dining room tables, essentially. And we had a large body of work with the Family Whānau Wellbeing Project, creating wellbeing indicators on the level of the family and household, producing a census data guide that was about how to align the sort of 1981 to 2006 censuses in terms of all the variable names, the variable codings, and all that sort of stuff. And then that was also the beginnings of our work in social simulation, which I heard from Barry about that over the years as well. And it was Andrew Spall who was actually sort of just saying these words at the time. I remember him talking about social simulation, and it was like, oh, I don't really know what it is, but here we are 20 years later, still talking about those sorts of things. So I call this a legacy of survey research because it does all go back a long way and sort of builds on what we've done. Thinking about the other thing of not just secondary analysis, but also preservation of data and our own data. In 2007, we set up the New Zealand Social Science Data Service, which was through a Nesta web view, and that was sort of the used thing internationally at the time. People could log in there and browse metadata, one-way frequency tables. They could ask permission to access cross-tabulations graphs and download data sets in various formats. It was quite, despite being a proprietary package, it was quite good at converting the data to a whole lot of different packages on the fly. And we had the New Zealand election study going back to 1990, which we retrieved back from the Australian Social Science Data Archive at the time, had been holding that. The International Social Survey Program data for New Zealand from 1991, World Internet Project, which was out of AUT, and the medical care surveys I was talking about, which was useful because that system really was good at allowing permissions and making sure that you knew who was accessing the data, because those collections were sort of more sensitive and had already protocols for sharing, which were made it quite difficult for people. The downside was it came with an annual license fee, and by the time of 2012, we declined to continue renewing that at the price of $12,000 US, I think it was a year, and moved on to other options. We had a summer student looking at Dataverse, which was an up-and-coming open source package for essentially institution-wide file sharing, data holdings, and it was well set up for this sort of thing. And as such, the UK and Australia moved to that platform in 2016. Oh no, around 2016. And meanwhile, the University of Auckland decided to set up a repository using Figshare, which by comparison was very much just a flat list of files of any sort that people could upload. There was lecturers uploading their PowerPoint slides and all that sort of thing. So it was quite hard to curate, but we've got a little corner there where most of the data sets that we had in our data service now reside. The New Zealand election study data sets are now in the Australian Data Archive because Lara Greaves ran the survey in 2020 and decided that they should be in a more prominent position again. So the problem with the Figshare thing is also that it runs on a DOI basis and creates a new version of every holding every time you update a file. And so if you have anything in there that you just realized people shouldn't have access to, there was no way of getting rid of it. And it was actually quite hard for them to get rid of the elections data from there, because it was always available old versions in that system. In terms of the surveys that we have run, 2011 we were contracted by Jack Vales, who at the time was the University of Exeter, and it made more sense for us to do it here domestically, to do the election survey for 2011. He'd been doing it since 1990, and I've just read in the University of Auckland social science events email that we advertise our seminars in, that Peter Amer, who was another principal investigator right from the beginning of the election survey, has passed away. So that is, it's just, you realize again, that's been 30 years that those surveys have been going on. We ran the survey again in 2014, 2017, and last year, as I said, Lara running it in 2020. The fact that we were then on the market for running surveys sort of a bit opened the floodgates of what we were then doing. We worked with colleagues at the University of Auckland who were Ngāti Whātua Ōrākei on a census survey of their iwi, of their hapu, which was very much a designed by Hui questionnaire. There was an awful lot of free text information, which just made it a bit more difficult in terms of survey design. But we were using all the things that we'd learned from running the election survey and the formatting and the distribution and all that. And those surveys, and then our work on the International Social Survey Program, which we took the reins of in 2013. Phil Gendel at Massey University had been running it from 1991, did 20 years. We've just come up to 10, and he then retired in 2010 and no one else had taken it on. So we then took that up. His daughter attended a colloquium of ours several years ago, and it was quite exciting to sort of have a bit of a survey geek out her about her experiences being in that, growing up in that situation. Within the University of Auckland, I then worked, we were within the building with the Centre of Pacific Studies, and I worked with Jemima Tia South on 2 surveys of Pacific families bereaved by suicide and the providers of care to those families. And then several other smaller surveys within the university, first of all using SurveyMonkey and then Qualtrics as the university preferred provider changed. And even for things like setting up registration for these events, I use Qualtrics because it's just a useful way of storing that information. More recently, we worked, as Barry mentioned this morning, with a group from Ngāti Hawa Iwi Trust on a housing survey 2022 with Bernadette Jones and Tristram Ingham at the University of Otago, Wellington, on a Maori health and wellbeing study with a focus on disability. It was called Te Ao Marama, which turned out to be a really unfortunate name because everything under the sun was called that at the time, and the website for it was a .maori.nz website, and people would go .org.nz or .ac.nz or find other things via Google because it wasn't searchable either. And that was frustrating because that was every other survey we'd run, it had been a matter of generally been sending out questionnaires. This one, it was sending out an invitation to complete online, which was a lot cheaper. And so we actually sampled 70,000 people in total for that survey and had more than 7,000 people in the data set, which was quite exciting by comparison to our usual target of 1,200 for the International Social Survey Program. And Barry mentioned as well, earlier this year, we worked with a team at Te Pairoa looking at the experiences of Maori creative professionals in the misappropriation and misuse of their professional works. And that was, as well as understanding of intellectual property, which was amazing because it was originally called Voices of 100 Maori Creatives, but they ended up with 150 responses. And I was just not used to that because every other time we were trying to get enough responses and struggling with response rates. In terms of the series, as I said, we've run the election study again and again. In 2020, they actually added on an incentive, I think it was a $20 voucher for every response, which was a large amount in the budget. And Lara also described an administrative nightmare and also emotionally draining because it was, of course, the study was running in through the Christmas period, and there were people saying, "Where's my voucher? I need this to spend for this period." And when I included that in the budget for the 2023, and Jack was just like, "What are you talking about? We don't have that sort of money." He was hoping to be able to present today, but he's not in the country, on holiday even, and is talking the same as what we are about struggling with funding and the response rates. This time around, he was trying to, we targeted people who they had found had a response rate that didn't really matter if they were invited to participate online or sent a questionnaire, and that didn't work out so well. I think it lowered the response rate overall, even though it made it a bit cheaper to send them the mail. For the ISSP, we ended up running 2 last year to catch back up on the annual cycle, which as a result, I'm still working on the weighting of the 2023 survey, and we're still trying to fund the 2024 survey, as Barry mentioned earlier. We're facing low response rates. Barry and I are on paper with Lara and Chris Sibley, who runs the New Zealand Attitudes and Values Survey out of the University of Auckland, on the ever declining response rates. The election study was getting 65% in 1990 and sort of around 25% last year, if that. And our ISSP surveys, well, it depends on the topic. As Barry said, it changes year on year. We got larger responses, especially with our sampling methodology where we try and oversample the minority ethnicities. We got larger responses to religion and to the health survey and social inequality even, and lower responses generally to the environment survey. And I think the role of government was the one that was a bit lower. So that's quite interesting as well, because you don't get just a cross-section of responses, but it does depend on that. And in terms of other things, trying to mitigate that idea, we did in 2017 try to set up an online panel formed in a probabilistic way to answer surveys, but we just didn't get enough of an uptake. And we're now looking at funding to turn our Marama responses into a panel going forward over the next year with any luck. But they're very much the legacy of surveys, and hopefully more to come. But sort of the experiences you have, especially when there is no power of the Stats Act behind you to get people to respond. What we find, especially we've talked about that here before. The other benefits have been, as I say here, we did manage to get COVID-related questions added to the surveys in those years when it's sort of like COVID findings around the environment and COVID findings around health in those 2 years. But it did mean we were delaying the surveys because of lockdowns and things like that. So it's been an adventure.
Excellent. You want to talk about the household pickup by courier that we tried because of COVID?
Oh yeah, so Barry's idea was that people didn't want to leave their house. This is actually, you had the idea before COVID. People didn't want to leave their house to go and deliver mail, and post boxes were getting harder and harder to find. So we were able to get the New Zealand Mail contractors to New Zealand Post to give us one-way courier return stickers that we would stick on the envelopes, and then people could have them picked up from their homes. Normally the way that it worked was, they would be sent out to multiple places, but they said they couldn't do the one-way for a whole lot of things coming to one address. And then suddenly they could in 2019, I think it was. But that has ended up being very costly in terms of getting those responses coming through, because the courier ones cost more. The previous idea was to print sort of a map of where their local post boxes might be. I had fun working out where all sorts of different places around the country, looking at the address file were and where the local maps are, and where on earth their post boxes might be. But that is something that is certainly a tricky one. We've offered an online option ever since the beginning, since the 2011 election study. It has never really got above a third uptaking that when you are sending them a questionnaire. And also, Barry was talking about this morning, we used to send them a pen. The pens in the back table are from this survey. And there was one year when we had 3,000 pens, and then discovered that the New Zealand Post now had new scanners that couldn't cope with an envelope that wasn't uniformly flat. And so we had to spend $2 per item rather than unpicking all these envelopes to get the pens out. And so we have still 1,500 pens in the office that we, over the years, have been distributing. And Catherine reported this morning that it's a very good pens. So if you haven't got one, just on the way out, they're in the back corner.
I was just wondering to do with the disability response. I was involved in, when it first came out, but I was actually involved in the pre-survey side of that, the design of it. And I'm just wondering, how has that, and did you find there was any difference during the COVID period to do with responses or what people could or couldn't do who had limitations?
In terms of our surveys that were going out in that period, I think we sort of, especially when we were asking questions around that, I feel like there was a bit of, when people wanted to get stuff off their chest, when we gave them free text boxes, I think it gave an uptick in responses. But as I said, our other survey in that period was on the environment, and that got a much lower response rate. The survey, the Murray survey on disability in that sort of time frame, which went out mid 2022 through to the end of 2022, I was just generally impressed with the response rate to that survey because it was specifically online invitation. There was also a phone option, and there was a request for a paper survey. But the downside of that was that I was sending them out in just standard letter envelopes, and for people to fill them and put them back in those envelopes was an ask. But not in relation to limitations over that period, I don't think. We're in the right topic area.